Hey, what's up, everybody? This is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth, and Denture Implant Center, and gonna talk about a topic people have requested about. It's having done an all-on-four surgery or a snap-on denture, but more likely information for an all-on-four surgery, assuming you got teeth in your mouth. Okay. Before we proceed, please give us a thumbs up if you like the video. Give us a follow on the channel, and also give us a follow on Instagram, Facebook. We are at North Texas Dental Surgery. So North Texas Dental Surgery, we got some before and afters. We show our team, fun stuff. So definitely going to try to keep be more active on that. So all right, jumping into the topic. So basically, you had an all-on-four done, right? So now you got teeth in your mouth. What's really going on? So let's go over some of our post-op instructions right here. So bleeding, obviously there's going to be some bleeding. What did we do? We took out your teeth. We smoothed out your bone. We placed dental implants. I know that sounds scary, but your patients, when you send them home, some of them are going to have some bleeding for a few hours. Some people, if you keep on spitting, you're going to see some pink blood inside your mouth, right? Obviously you're going to have some bleeding like that day, maybe even a little bit the next day, right? Or the day after, just a tiny little bit. What we're really worried about is if you have continuous bleeding that's going on, that's like, wait a second, I got blood pulling up in my mouth. This is a concern. What can I really do about it? And then basically for cases like that, you want to just basically have some gauze and then put some back there, and you can apply some pressure. So that'll significantly get the bleeding to stop. Obviously, just take a seat also, relax. Don't get your blood pressure up. Those are things that'll also help too. If you have bleeding that's going on longer than normal, then what I would highly recommend is communicate with your surgeon. Give them a call, give them a text. At our office, we say, hey, give us a text. That's the quickest way we're going to get a hold of you. I get patients by phone number, but then give me a text and then we'll see what's going on. Worst case scenario, we'll have you come in. I've never to this day seen an all-on-four bleeding like that, but it's always a possibility. So one other thing that I want to say before we go deeper into this is that these instructions are basically for like the average patient, right? I like to tell people in regards to, like, some people even tell me, well, like with swelling or discomfort, there's a bell-shaped distribution curve, right? So most people are going to be within that curve. You're going to have some that literally, no joke, we do an all-on-four on, and they are not swollen at all. They don't even take ibuprofen, and they just, like, that's what their experience is like, right? But you can't take that person's experience because, again, like, most people are gonna like have to hit the ibuprofen during the days, and then maybe take some hydrocodone at night. They're gonna have pain on a scale of 4 or 5 out of a scale of 10 for the first few days. And then on the opposite side of the people who have no pain, there's going to be people who act like you cut your arm off, right? So just because like everybody's got a different pain tolerance, so it is what it is. But I just want to let people know again that most people will come within the average of the bell-shaped distribution curve. All right, so let's talk about oral hygiene, how you take care of your teeth. So what we want our patients to do is basically rinse with salt water, right? Half a teaspoon of salt in a cup of water. Rinse 30 seconds. I want you doing that 2, 3, 4 times a day, however many times that you feel you can do. I want to keep your mouth clean. I want you to use a soft bristle toothbrush. I want you brushing your teeth. I don't want you using a toothpaste that has like any grittiness in it, because what that can do is that it can start like basically making your teeth lose some of its luster. So you don't want to use with an abrasive toothpaste. Personally, like at home, like I use like Tom's toothpaste. It's not abrasive. There's many other toothpastes you can even order on Amazon, but just get a toothpaste that doesn't have any abrasives. Make sure it doesn't have any whitening, because it can actually start to affect your prosthesis, your teeth. Definitely do not use a water pick for the first month. The reason why we don't want that to happen is that the gums are healing significantly during that period. If any sort of opening in your gums underneath the prosthesis, if you use a water pick, it can introduce bacteria underneath your gums, cause an infection, cause an abscess. That would be a big problem. So we do want you to use a water pick after 1 month, but definitely not before that 1 month mark. Typically at our office, we bring you in at the 1 month checkup. We take your prosthesis off, we clean in underneath there, get rid of any of the dissolved sutures in that area, and then make sure that you're clear to use the water pick. Swelling's a big thing, right? So I definitely want you, so a little background about swelling. Swelling typically peaks on the 3rd or 4th day. Everyone's different. Some people swell the most the first day, some people swell the most the 4th day. I would definitely recommend a lot of ice, a lot of ice, a lot of ice. That whole day, even the day after. Sleep with your head a little bit elevated. That helps a little bit too. One thing that we do with swelling is we also make sure that our patients get a Medrol dose packets and oral steroid. We start them 24 hours before your procedure. That does help significantly with swelling. And there's even another product out that one other person, she does a lot of digital dentistry. She was telling me about that her patients had a lot of success with. So maybe I'll create another video about that. But swelling can be a big deal. But there's certain little things that we can do to help it out. But it's not going to negatively affect your results. But don't be surprised if you do have swelling that can last for a few days. All right, so medication, what we typically do is we give patients like NSAIDs, ibuprofen, and also hydrocodone in the event that the NSAIDs are not good enough. We also make sure that we give you antibiotics. You have to finish your antibiotics. And also, I don't care if you're not in pain, I want you on your ibuprofen every 6 hours for the first few days. And after which point you feel like you can get off the pain meds, then you can discontinue the pain meds. All right, so here's the big thing, diet, right? So what are we talking about? Diet is basically, anybody that does all for you is going to tell you just be really careful, like what you eat. You don't want to eat hard foods. You don't want to eat crunchy foods. When we place these dental implants, I like to tell people that it's like waiting for concrete to set, right? If your bone is dense enough that when I place those implants, when I use my little instrument to measure how strong or tight those implants are going in, my torque meter, I'm obviously not going to I'm not going to put your teeth, this is the prosthesis that we screw in, right? So we're going to make these teeth. Once I place your dental implants, I'm not going to screw this in unless your implants were tight enough, right? So, and then I'll also tell you, at the same time, even though you had enough tightness, I do not want you going home and tearing into a bagel. I do not want you biting into a burger. I don't want you biting into an apple. I don't want you going home and being excited and chewing into steak, all that stuff. Believe it or not, I've had patients do that. You just want to stay as soft as possible, right? Quick little example, if I'm gonna bury a post in the ground, let's say I get deep enough into the ground, maybe even to the bedrock, where basically this post isn't gonna move, I'm still gonna pour some concrete around it, right? But let's say I got into the rock and my post isn't moving, I can still build on top of that, but do I really want to go all out? And that's kind of like what we have with these, right? So you can still chew, but do you want to go all out? Don't be testing your teeth out with jawbreakers, because you can actually cause your implants to fail. So unfortunately, there's not a lot of research in regards to like, hey, up to what time? A lot of stuff is just anecdotal. It's just experience that a lot of surgeons have of what's worked for their patients and not. Obviously, you're doing a big surgery. You're investing a lot of time and money into this procedure. You don't want to screw up the results. So just make sure that, as long as you can hold out, you just want to stick with that soft diet, okay? And avoid like really crunchy foods, really hard foods. They say up to 6 weeks. Some people will tell you during that first, if you're doing an upper jaw, during that first 4-month period, that you got to be really careful. And then for the lower jaw, 3 months, right? Because the upper jaw is softer bone. But I mean, my personal opinion, I'm always like to under promise and over deliver and err on the side of caution. So I'm going to tell my patients, hold out, use the soft diet as long as possible, okay? In regards to activity, I just tell my patients, listen, whatever you feel like you can tolerate, I'd say take a 2 days off, a few days off, right? Maybe like a day or two. Depends on if we're doing your whole mouth or just we're doing one arch, right? Depends on how old you are too, right? So you know your body best. Do you want to get back in the gym? Does it make sense, to tell my patients that they can run 5 miles the next day? I would tell you, probably not, right? Do you want to go to the gym and start squatting the next day? I would say, hey, maybe take it easy. I don't want you fainting because you're exerting yourself so much. So just try to take it easy for a little bit, but I'd say a few days later you can start working out again. Any sort of allergies, basically you would know because you'd be developing a rash. You'd be probably allergic to the hydrocodone or to your antibiotics, so just let us know. These are just some food suggestions that we had. Juice, Ensure, we were talking about protein shakes, stuff like that. Anything cooler, softer, definitely don't use anything that has, don't eat any foods that has little seeds in it. I've seen people recently with popcorn kernels and like a wisdom tooth socket that got a pretty big infection. These are, again, just examples of soft foods, diets, soups, shakes, soups, pudding, scrambled eggs, all these things to give you some nutrition. I know it's frustrating, but these are some things that you can do. One other thing I wanted to highlight in regards to like post-op, like things that you need to do, definitely make sure that if you're a smoker, and I always tell my patients, no smoking a week before your procedure, and no smoking up to a month after your procedure. I've been doing this for 11 years. I've done over 10,000 implants, and on top of, like, I mean, how many wisdom teeth have I done? How many extractions? How many gum grafts? All these different types of surgeries. I'm going to tell you, just hold out as long as possible. I used to let people back in the day, early in my career, smoke in the dang parking lot before they came in for surgery. And I honestly even saw that, I mean, as long as they weren't lying to me, but they were saying that they didn't smoke after the surgery and they still were having issues with their surgical results. So I don't even let people smoke a week heading into the surgery. So I know it's a tough task, but again, all these things are tough, but you are making a very expensive investment. You're taking time out for this procedure. Us and our staff are taking time out for your procedure. We want the best result for you. So these are just things that we highly recommend that you follow to make sure you have the best result. Okay, so hopefully this information was very helpful for you. If you have any questions, please leave them in the comment below. Again, give us a follow, give us a like. Also follow us on Instagram and Facebook. We are North Texas Dental Surgery. Thank you so much.